This is Dr. Mapakshi. I'd like to talk about sodium. What is the significance of taking too much sodium in your food and how it can affect your health? As we talked in our previous videos, the risk of hypertension, hypertensive heart disease, hypertensive kidney disease has nearly doubled in the last couple of decades. And this is predominantly linked to our lifestyle changes, including dietary changes. So the foods that we eat today are loaded with sodium. Sodium is used as a preservative in many of these packaged foods, which has contributed to development of hypertension. So sodium is sodium chloride, which is the regular table salt. Sodium is present as in many preservatives that are present, that are added to the packaged foods. Baking soda, baking powder, those also have sodium in them. So again, we recommend dietary recommendations are for a low sodium diet based on the DASH study, which is Dietary Approaches to Stop Hypertension study, has been to limit to less than 2300 milligrams per day. However, people who are diagnosed with hypertension, the recommendations are to go even lower, less than 1500 milligrams per day is the recommendation currently. There are lots of food labelings that you need to be aware of, which I'll talk in a minute. So some of the common sources of sodium are in the staple, convenience foods like boxed soups, canned foods, savory snacks, canned vegetables. So these are some of the, where the salt is added as a preservative. Again, some of the condiments like ketchup, mustard, salad dressings, barbecue sauce, spaghetti sauces, these also have a lot of salt in them. Pickles, relishes are another big source of sodium. Some of the meat products that are processed and cheese, both of them are also very high in sodium. So sodium labeling, very important to pay attention to these, as most of the packages are now updated and as we are conscious about the amount of salt that's added to each, it can be greatly helpful once you are paying attention to the labeling. So sodium free or salt free means that the serving has less than 5 milligrams of sodium. Very low sodium can include up to 35 milligrams of sodium. Low sodium would be anywhere around 150 milligrams or less. Reduced or less sodium would be about 25% of the regular version. Light sodium would be 50% less than the regular version. Unsalted would mean that there was no salt added when it was processed. So the key is to cut back salt regularly, because once you start taking in less salt, then you will appreciate the sodium that's naturally present in these foods, especially greens like spinach. They have a lot of sodium naturally, so that you will start appreciating the sodium that's naturally present in the foods once you stop adding salt. The other thing that I want you to pay attention to is salt substitutes. Anywhere a salt substitute, there is addition of potassium chloride. So especially my patients with the kidney problems, I want you to pay extra attention to salt substitutes. I would totally avoid them because potassium can build up and high potassium can be dangerous. So we want you to avoid the salt substitutes. I hope this helps. Take care.